the things that physical therapists complain about and some of the things that I'm sure are going to come up. And I want to get to the root cause because I hear a lot of complaints and a lot of blame going out, but I don't think the blame is going where the blame should be going. So let's take one topic, and that one topic would be poor reimbursement by insurance or insurance cutting visits, things like that. So I know that insurance is a mega corporation. Each insurance company is. Their whole point is to collect their premiums from people that they cover and not to disperse any payments. So try not to pay for people's physical therapy, MRIs, surgery, all that kind of stuff. So I know that, but let's move forward from that a little bit and say, okay, so what else drives insurance and their willingness to pay for physical therapy? What about results? So if we have evidence-based practice that shows us over and over and over again that physical therapy doesn't work for knee pain, doesn't work for back pain, doesn't work for lateral epicondylitis, doesn't work for plantar fasciitis, whatever, and those studies are out there. If I'm the insurance company, I'm going to take those studies and say, hey, look, this stuff doesn't work. So when people do electrical stimulation, or when they do massage, or when they do exercise and they do modalities and whatever it is that these studies looked at that were unsuccessful in the treatment of these conditions, they can say, well, why are we paying for physical therapy if people aren't getting any better? So we're not going to pay for this. So whose fault is it that patients aren't getting better? Is it the insurance company's fault? No. Would you pay, if you had to take your own money out of your pocket, would you give it to people to go get treatment 2 to 3 times a week for 6 to 8 weeks for something that would go away by itself in 6 to 8 weeks? So we know that if we have idiopathic low back pain and we don't do anything for it for 6 weeks, most likely it will self-resolve. We also know that the typical treatment at a physical therapist is 2 to 3 times a week for 6 weeks, which means they could have just stayed at home and got the same results. So why would I take money out of my pocket to pay for somebody to go to physical therapy for 6 weeks when I know they can stay at home and do nothing and get the same results in 6 weeks? So whose fault is it? Is it the insurance company's fault that the patients aren't getting results? No. Is it the physical therapist's fault that the patients aren't getting results? Yeah. And whose fault is it that we don't know what we are doing? Whose fault is it that we are using modalities that have been proven over and over and over again to be ineffective? Whose fault is it that we're doing things that are actually more detrimental than beneficial, like stretching and massage and foam rolling and all of that stuff? Whose fault is that? Who put that in our head and told us, hey, you're a physical therapist, this is what you're expected to do, go do this? Who put that in our head? Did I graduate PT school and tell myself that's what I'm going to do? Nope. I was told that by the university, the college that I went to, the PT school that I went to, the rotations that I went on. So the problem, the root cause with poor reimbursement is not an insurance problem. The problem with poor reimbursement, the root cause, is not a physical therapist problem. It's an education problem. And now we get back to the university or the PT school